Kia ora and welcome to this hui held the 28th of April 2022. I'm Shona Jaunas, President of Open Forum for Health Information. Today's hui is on the Ministry of Education's consultation looking at the promotion and provision of food and drink in New Zealand schools. You can find a link to the consultation documents in the comments section below, as well as some links through to more information and where you can reply to the consultation yourselves. And we would like to stress at this point that it is really important that as many people as possible do reply to this consultation and make their voices heard. We have a wonderful expert panel here with us today. Sue Kedgley, who was a Green MP from 1999 to 2011 and campaigned very fiercely for healthy schools during her time in Parliament. Dr. Julia Rucklidge, Professor of Clinical Psychology in the Department of Psychology at the University of Canterbury. Dr. Gerhard, who is Senior Lecturer in Pacific Health and Population Health at the Faculty of Medical and Health Sciences at Auckland University. He's also one of the founding members of FIS, which is a group of researchers and public health doctors who advocate for ending the sale of sugary drinks in New Zealand. We've also got Dr. Sally Mackay, who is co-chair of Health Coalition Aotearoa, and she'll talk around the guide that they've developed to responding to the consultation. Also online we have Daniel Martin, who is from the Ministry of Education, and he is running this consultation. Sue, I'd like to start with you. Could you talk us through a little bit of the work you've previously done on healthy school food and nutrition guidelines?
Kia ora koutou, and great to be on this panel, and fantastic initiative for Open Forum for Health Information. And yes, that's true. That is the guidelines that I'll just give you a bit of background on are indeed what we're discussing today. So just to give you a little bit of history, as I was a safe food campaigner, as Shona pointed out, when I found myself in Parliament, I was very focused on the impact of food and nutrition on health. So I sort of started looking at schools, and my office started conducting surveys of school food. We did 5 surveys, and we quickly discovered that unhealthy food was the norm, that 90% of the food that was sold in schools was, pies, donuts, fizzy drinks, so sausage rolls, chips, etc. Chocolate fundraisers were extremely common back then. Also McDonald's vouchers to reward children who are doing well in school. So in 2005, after the election, the Green Party negotiated with the then Labour government to introduce healthy food guidelines into schools. And I spent 2 years negotiating them through with the Ministry of Education, etc. And they were released in 2007. I think they were called the School Food and Beverage Guidelines, and there was a direction for all schools to implement them. Then, as you said, I got secured funding of 12 million to train canteen staff around New Zealand, because what I quickly worked out that one of the drivers of unhealthy food was the fact that it is so much easier and more profitable to sort of put a pie into a microwave and sell that than it is to make healthy food. So, all canteen staff all over New Zealand were trained in healthy food. And the feedback that we got on that first year, 2007, was that most schools were welcoming the guidelines, that they were making good progress in implementing them. It had improved the school food environment, and we were starting to see better eating habits, improved behaviour and concentration in the classroom. But then there was a change of government in 2008, and almost the very first act of the new national government was to scrap the school food guidelines on the grounds that they were a heinous example of nanny state, which the government had campaigned on during that election. And they replaced them with this weak provision that they should promote healthy food in schools. And the interesting thing is through the Official Information Act, I learned that this decision was made without consulting any schools, without getting any advice from the Ministry of Education or the Ministry of Health, about whether the guidelines had been working or whether there were any problems with them. And once they were scrapped, there was no monitoring of the impact of scrapping the guidelines on the schools. But the Canterbury District Health Board did a bit of monitoring, and they found that the repeal of the guidelines had had an almost immediate impact on many schools. Some persevered and had, water-only policies and tried to promote healthy food. But many fell back into unhealthy food, becoming the norm, sausage rolls, cream buns, etc. And this indeed has been the situation for the past 14 years. And again, there's been no monitoring, but the anecdotal evidence suggests that once again, and indeed for these past 14 years, unhealthy food has become the norm. And of course, the unhealthy food that's sold in school canteens is far cheaper and far more accessible than any healthy food that's on offer. And of course, we've paid for this in terms of skyrocketing dental disease, obesity, and type 2 diabetes. So, I'm delighted that we are now, 14 years later, revisiting this issue. And I strongly support your proposal for extending the new regulation that the government's proposing to bring in around healthy drink to food as well. I think what people sort of many people forget is what an incredible impact the school environment has on children and young people, because most children spend about 13 years of their life in a school, and that's, except for school holidays, 5 days a week, 6 hours a day. So schools are incredibly influential about the way children think about food, as well as their setting their eating habits. And I don't need to tell all of you who are gathered here today about the overwhelming evidence of the link between poor nutrition and academic performance, that students who are well nourished are better able to concentrate in class, better behaved, whereas those that are loaded with caffeine from fizzy drinks and sugar have difficulty concentrating in class and learning, behavioural problems, and can influence not only themselves but those around them. And this, of course, particularly affects Māori, Pacifica, children from low-income families, etc. And, overwhelming evidence that poor nutrition and diet is the leading cause of death and disease, particularly the type 2 diabetes, dental disease, obesity, etc. So, it just seems to me that in terms of as a simple and effective public health measure, introducing healthy food in schools is just an overwhelmingly sensible proposal that would save literally billions of dollars, billions in the health spend. The only thing I would say, based on my experience, is it really is important to try to get cross-party support for this, so that if we do manage to bring back some sensible healthy school food guidelines around food and drink, that they're not scrapped that they survive a change of government. So I think it's really important that somehow some of you, leading academics and so forth, are able to try to contact members of the National Party and get them on board with what seems to be just such a simple and effective public health measure.
Thank you, Sue. Gerhard, could we hear from you now and more around the work that you've been doing with fizz, and particularly sugary drinks in primary schools and in secondary schools?
So we established fizz in around 2013, and we prioritised getting sugar out of consumption, and we were targeting children particularly. And the reason why we're targeting sugary drinks is that sugary drinks contribute 26% of all sugar to the diets that children consume. So we figured that if we can make a strong change in the sugary drinks, we'll be eliminating about 26% of sugar intake from children. And also too, it's kind of like an easy option. The sugary drinks are unnecessary, and so we felt that it would be an easier option for us to make real change. And the ways that we wanted to go about doing that, there's about 3 key priority areas. One is a tax on sugary drinks. 2 is better labelling of sugar content of drinks. And the third one was getting sugary drinks out of schools and like promoting water-only policies. And in 2015, we established the New Zealand Beverage Guidance Panel, which was modelled off the American Beverage Guidance Panel Professor Barry Popkin established. And we have written a number of different policies, one making a case to address sugary drinks generally at different levels. The second policy brief was around a sugary drinks tax. And the third one that we presented to Parliament in 2020 was about water-only schools. And what we advocated for in that is that all schools and ECEs should be water only or sugary drink free. And we defined a sugary drink as having 5 or more grams per 100 mils of sugar. And so there's a lot of debate around the room around whether zero sugar options would be allowed within that policy, and we thought that would be okay, which is a bit different from the options that have been presented. And then probably most recently, we wrote a paper that was published in the Australian New Zealand Journal of Public Health, and it pointed to the fact that industry have had policy where they won't sell drinks directly to schools since 2009. However, drinks are able to come into school grounds because there's no policy that stops them from coming in. Sue spoke earlier about the policies that did exist up in 2009, but then those were taken away by the national government. So I think the idea of having policy to match or even be stronger than what already exists on the industry side, I think is totally necessary. We know that high school students are the largest consumers of sugary drinks, and there was a study done, I think 2017, and it found, because some schools have adopted water-only policies already, but we've found in a study that 30% of primary schools, 50% of intermediate schools, and 100% of high schools still had sugary drinks available, and that could be in the form of flavoured milks or energy drinks or juice, full sugar juice. Regardless on whether or how they can be policed, I think by having a policy that stops them from being sold, it sends a clear message to the staff and the students and the community that those drinks are not good for us, for our children. So I think sometimes we've talked about it with a tax as well. Just having these policies in, it sends a strong health promotion message.
Thank you, Gerhard. I think that really outlines the importance of restricting the supply of sugary drinks to our tamariki and young people. One of the other things with this consultation is whether we should be looking at the nutrition in schools as well as the access to sugary drinks. And at this point, Dr. Julia Rucklidge, I'd like to invite you to speak a little bit about your work to do with mental health and nutrition.
So just to give a background to the members of the panel of what I've been doing for the last 15 years, as you said, I'm a psychologist by training, and my training in psychology, and this will be very true of medical school as well, is that nutrition is irrelevant to brain health and that it doesn't play a role in terms of the treatment of psychiatric disorders. So that was in the late 1990s. But what led me to do the work that I'm doing was just a curiosity, was just hearing about families who are using vitamins and minerals, micronutrients, to treats what would be deemed as serious psychiatric problems like mood disorders and psychosis, and getting well and staying well with these nutrients. So I decided to study that idea back in 2007, just giving people who were struggling with ADHD, which is very relevant to this discussion, my vitamins and minerals in a pill form, and seeing what happened to their behavior and to their ADHD symptoms, as well as other problems like anxiety and substance abuse, all the things that they came in with. And it was really quite stunning in terms of the remarkable benefit that many, not all, experienced from just getting additional vitamins and minerals in a pill form. So I did randomized controlled trials where we used placebos to really not out that this wasn't a placebo effect that I was observing. This is now being replicated. It's all being published in peer-reviewed scientific journals, very well respected ones, and so we have a very solid and robust data set that now shows that giving people additional nutrients is important. But it's led me now to really think about the food environment, because why is it that we are having such an effect on people when technically they claim to be following the dietary guidelines and eating good food and healthy food? And so why is it that some people seem to benefit from this? And so it's led me to really learn about our food environment and come to the realization, which I know all members of the panel have probably come to, which is that our food environment is a complete mismatch to what our brains and our bodies need. And this is as a consequence of the rise in the ultra processed foods that we have introduced into the human diet over a very, very short period of time. So less than 100 years. So we are trying to, meet the needs of our body with these foreign substances that are devoid of nutrients, and in particular micronutrients. So the conversations that I see are often around what the content of foods being around fats and carbs and proteins, and of course those are important macronutrients. But what's overshadowed is thinking about the micronutrients of our food, and that is the vitamins and minerals that are essential for everything that's going on, everything these kids are needing to do, moderate their behavior, be able to concentrate, be able to manage their moods, self-regulate. I'm hearing all about how kids coming into schools these days are unable to manage themselves. All of those behaviors were, in order to be able to be, well, even keeled in those behaviors, you need micronutrients. They are the building blocks of your neurotransmitters, like your dopamine, like your serotonin, all those neurotransmitters that are so important for good optimal brain health. And they are missing in our diet. So when you put together, you couple the observations that we've made, and then you look at our food environment, which is, when the data, the big observational studies show that 60% of our calories are coming from ultra processed food, it doesn't take long for us to go, this is just unacceptable. We've got this as a train wreck. It's happening in front of us. We have all of the data. We don't need more data. We have the data showing that our food environment is absolutely related to, as has been mentioned here, obesity, type 2 diabetes, cardiovascular health, teeth, and I've added on brain health. And that's something that is forefront at the moment in the public eye, is that we have a mental health crisis. And with that, if we don't address the food environment, we know the consequences of this. So I think it's great that we're looking at this idea of the drinks, but really though, my worry is that we're focused on removing things out of the canteen that we know are, I'm completely on the same page as everyone. Take out the sugary drinks, absolutely. But we continue to focus on food as in terms of what's not in it, as opposed to what's in it. And if we could focus on every time you put something in your mouth, you're putting something in your mouth that's nourishing your brain, that isn't devoid of these nutrients, then we know that those kids are going to be able to concentrate. We know those kids are going to be better able to manage if they're eating foods that are nutrient dense. We owe it to our children to change this environment, and to stop at the level of just the sugary drinks, I think is really giving a total disservice to what really needs to happen, which is that we need to remove ultra processed foods from our diet. That's my big, vision. To stop at just the drinks is just it's just giving, a bit of lip service to it, of saying, yeah, we recognize that we need to take some of these things out, but it doesn't mean that we're giving those kids the nutrients that are so important for learning. It's completely ignored in this kind of revision of legislation or change of guidelines or whatever. So that's what I really would love for the conversation to be about, everything that you're putting in your mouth, not just about the sugar, not even just around the Coke Zero. I mean, yeah, it doesn't have sugar, but it's got things in there that we know are detrimental to our microbiome and are having a negative effect on our gut flora. So I don't see them as being inert in any way or shape or form, but they also, again, have zero nutrients in them. So why do we see this as being an okay way for us to drink?
So we've got Dan Martin here from the Ministry of Education. Dan, could you speak a little bit to why you haven't prioritised secondary schools in this consultation and what your position is on the issue of nutrition in schools?
Why not secondary schools? I mean, ultimately, right now, it's a matter of timing and lack of information. We understand from a 2016 Auckland study that only around 27% of secondary schools had a water-only policy at the time the study was conducted, versus around 70% of primary schools. We don't routinely monitor the provision of drinks in any school setting, since it's a quite granular thing to monitor. And I know from my time in Welsh Government working on this same policy, which included food in all settings, that it can be quite burdensome for schools to respond to on a quarterly or annual basis. So our main driver for the policy was the replacement of NAG 5B, ensuring that really important duty to promote food and nutrition remained in effect from the 1st of January 2023. And obviously, if you're going to make regulations under the Education and Training Act, then you're given an opportunity to strengthen those regulations. So one of the quickest wins that we could see there was to accept that a majority of primary schools were already doing this and to raise all the remaining settings up to a minimum standard of healthy drinks provision. We also thought it would be useful to conduct the public consultation to get more information from secondary schools about why it is that a small amount have them, but a majority don't. Because the fact that around 27% back in 2016 had them kind of implies that this is entirely possible. But the fact that a majority have chosen not to shows that there may be some barriers there in particular school settings. So obviously, no one secondary school is the same as another. So this is definitely something that we want to do. It's something that the Minister signalled in the proactively released cabinet paper that got agreement to releasing the public consultation. But we need to know more before we apply a similar policy on a national basis to these very large schools. There may be a resource issue, there may be a funding issue, and if that is something that we need to support, then that's something that we need to go to a budget bid process for, which takes place at a certain time of year, that would take place after the 1st of January 2023, when the current NAG stopped having effect. So it's not that we think that children's teeth magically become immune to sugar as soon as they hit secondary school or anything like that. It's largely just a matter of practicality at this stage. And as I say, it's something that we definitely want to move into. But doing primary schools first allows us to kind of move the Overton window a little bit more towards secondary schools, and then potentially at some point in the future, and this isn't official government policy or anything like that. This is largely me just talking as Daniel Martin. That can open up the conversation a bit more widely to food regulation as well.
So what can we do, Dan? What's the best thing for us to do at this point to get this issue on the table?
Make a submission. I'd be absolutely desperate for you guys to get a fulsome submission into the consultation, absolutely sure. But also, you've done a lot already. I mean, there's several people on this panel that would recognise their name cited in the footnotes of the cabinet paper that was put forward that allowed me to put together a very robust case for change here, and then to get that past cabinet as far as it has. I mean, So, I mean, anybody who's unfamiliar, anybody who's not as boring as me and sort of gets a bit of a kick out of the policy to legislative implementation process, there's kind of 3 key milestones that you have to get past and that you need to get Cabinet's agreement to. We've got the first one, which is the agreement to go out to public consultation, which is what we're in now. Following robust analysis of all of the submissions, we'll be making changes to the policy settings, the specific ones, before going back to Cabinet later this year to ask for their permission to kind of ratify those final policy settings and then issue drafting instructions to the Parliamentary Council Office. Then there'll be a long period of back and forth between officials and the drafters to make sure that you really get the settings right. And a lot of that will come down to really specific wording around how you police these sorts of things, what those, I mean, we're not calling them exemptions, it's more just circumstances under which the duty won't apply are appropriate. So is that very infrequent events on the school calendar? Like, the more specific you can be in your submission, the more I have to work with to make sure that these things actually land in the implementation. And then obviously for the third and final milestone is just gazetting the regulations as well and getting permission to do that. And that's then when it comes into effect 28 days later.
That leads us very nicely to Dr. Sally Mackay, who is here from Health Coalition Aotearoa and is going to talk to us a little bit about their guidelines in responding to this consultation.
Yeah, I'm not sure if all of you know about Health Coalition Aotearoa, so I'll just very briefly introduce ourselves. We were set up a few years ago, chaired by Professor Boyd Swinburne, who I'm sure most of you have heard of, and we have 3 expert groups, alcohol, tobacco and food policy expert group. And along with Lisa Temaringa, her and I are the co-chairs of the food policy expert group. And one of the, we have 3 top priorities, regulating all unhealthy food marketing to children. And that's partly why I'm late, because we're having a lot of meetings about that at the moment. That's our big focus. The next one, which ties in really well with this, is about schools and early childhood services developing food policies to ensure healthy foods are available and promoted. And then the third one is about a soft drink industry levy, which we're not really working on at the moment, but we are focusing on those first 2 policy priorities. And one of the key roles is advocacy and making submissions. So we've, a lot of us have actually been on leave for the last few weeks, so we haven't had a lot of time to think about this, but we have put some ideas together. So they're very much in the initial phase. And I mean, Dan, your comments about being as specific as you can be are really useful, because that's something that we can work on doing. So I've just picked out a few of the questions. And actually what I see I haven't done is put in what the question was in full, but do you agree with the problem, which is focused on oral health and obviously very important, and I apologise if you've already had these discussions, but we are saying that oral health is not the only issue, that there is a lot of other issues about weight, and Julia's talked about mental health, etc. And from my sort of nutrition hat, I would say lack of intake of fruit and vegetables and some of those key foods. So we are proposing to extend the problem as being wider than oral health. And Dan, I appreciate that you've got to start somewhere, and that's why you're focused on drinks first, because it often is the easiest one. Question 3, which is about objectives. So I've put the ones in there that are in the consultation. Following on from Julia's comments, we completely agree that food should be in there as well. And I've been a public health nutritionist for many years and was very involved in the healthy eating, healthy action work that some of you will remember, where we were talking about food and drink, and we were supporting schools to have healthy food and drink provision. So I believe that we can do it again. We had a brief attempt at doing it in the past. And again, that children's hauora is the priority goal for all schools. So having a wider view in there. Question 4, we actually are proposing a new option, and as I've said, that is all schools, so primary and secondary, and having healthy food and drinks. So I guess we are being perhaps optimistic in our submission and what we're suggesting, but we believe that we should be saying what we really want in our submission, and that's what we're encouraging others to do. We know this doesn't always happen when it goes into policy implementation, because there's a political side to this as well. And then the other questions in between, I think we mainly agreed with. And then compliance, there was just a few suggestions from our brief brainstorm about compliance. We realised that this can be difficult and time consuming, and even though I wasn't involved directly in that 2016 survey, I was sort of on the periphery, and I know how difficult it is to get schools to fill out surveys and to respond, and particularly long surveys about food. So we appreciate that there's got to be some realism in this, but simple things like having to post the school policy on a website, maybe some simple self-reporting. And I remember with the original NAG5, Aero had it as one of their key, I don't know what the terminology is, but something that they got schools to report on. So again, you know, it could be done if it was enough of a priority. And agreed with the light touch at the beginning, you know, thinking about resources and the school environment, but reviewing it after 2 to 5 years to see how effective it's needed and if a stricter approach needs to be taken. So those are our initial ideas, and I've got a few meetings coming up in the next week with public health units, DHBs, and our own food expert group to get some wider discussion about what we think should be in the consultation. So really interested to hear other people's views, and particularly if you've got anything to add to this or anything that you disagree with, because I think it will help from our nutrition health point of view that we do have somewhat, we don't have to agree on everything, but there is somewhat of a consensus about what we're saying.
I agree, healthy food, if we could put it in there, it would be great as well. But I'm wondering, considering what Dan's already said about having the opportunity to maybe strengthen bits because the law is changing, and, you know, it's perceived that extending it to high schools might be a step too far. I'm wondering if we're better to focus on trying to get high schools to adopt this policy for the drinks, because it might be within, it might be achievable, rather than trying to push food in there as well. But I know that's the best option. I agree with you, Sally. But yes, I see Dan wants to respond.
So I'm fortunate enough to have a direct comparison, and having done this before back in Wales, where we brought in, as I say, food and drink standards in regulations. On the lead up to that, it was a programme called Appetite for Life, which was supported by grant funding and rolled out very gradually over all of the 1,400 different school settings in Wales. That took us 7 years to get to a position, iterating on the sort of the nitty gritty of how much honey can you put on a piece of toast, and like really, really granular questions like that, all the way through to get them into a position where we could then translate them into regulations, and then just provide funding to schools as a block grant. That's obviously a long time. I mean, drinks are easy. Like, you know, drinks advice is literally 2 words: drink water. It's the best thing that you can drink at all times for everyone. No one's allergic to it. There is obviously no single food item that you can consume that would be the best thing that you could eat as long as you ate it all the time. And there's a number of other things to take into account, like specialist diets, the local infrastructure and supply chain for getting things to quite a lot more schools. I think 2,500 schools in New Zealand, across a much more sparsely populated geography. So there's a lot to take into account when it comes to food.
But just as I've explained, we actually did it in 2 years, and there are these healthy food guidelines, and we did implement them across all of New Zealand, including secondary schools. And the important thing that seemed to be the game changer was to train all the canteen staff, because most of those canteen staff, as you say, they're there to make a profit, and it's so easy just to sort of, as I said, shove the sausage rolls and the pre-made pies into a microwave, so much easier for them. In reality, it can be done because we did it. And I do agree with your point that, if we are going to focus on drinks, one should be going for secondary schools as well. I agree that food, it's not so much that food is more difficult, but you've got this whole food lobby which can come in and argue the case about what is healthy food and come up with these ridiculous star ratings that Julia referred to, which have almost ended up as marketing ploys for the ultra-processed food industry. So it's more that it's a fraught area. And this gets me to my other point, which is that really we can do all the best submissions in the world. I think it's fantastic you're all planning to make these submissions, and great if you could agree and to come up with a coherent position. But ultimately, this is all political. And there's nobody in New Zealand, and probably no politician, who thinks that we should be promoting unhealthy food in our schools. I mean, why do we want to give our school children unhealthy foods? We don't. It's just that it's become a sort of political issue, with the Nat saying that it's nanny state, etc. So really, what it boils down to is that in the end, Dan is obviously, I think it's great that you're here, that you've got this background in Wales, but I understand, Dan, that you're the public servant. It's the politicians who are going to decide on what is the politics and how much political capital should they expend, quote unquote, on this issue as compared to all the other complicated issues that they have on their plate at the moment. So that's really we have to make a sort of political calculation about whether there is the political will and commitment. I don't see any particular MPs who are passionate about this particular issue, regrettably. I'm prepared to champion it in Parliament at the moment. And I see also the strength of the food lobby that will try to undermine by arguing about what is healthy and what is unhealthy food. So the simplest thing would be, just as you've said, extending that water only to all schools as an absolute minimum. But the only reason that we wouldn't be extending it to food is for political reasons. I mean, it's not nothing to do with public health or policy, because we all know that no child should be being encouraged to eat unhealthy food.
Dan, when you're talking about only 26% of high schools had any policy on drinks, I think in 2015 there was policy brought in that took the sale of sugary drinks out of all DHBs and hospitals, and so I think it can easily be done. If it's been done in DHBs and hospitals, it can be done in high schools quite easily. So I think it's something for us all to be aware of.
Yeah.
Thank you.
In fact, you could use the DHB guidelines because they took a lot of, fine tuning.
I will say that one thing that we are aware of in the Ministry of Education is that it's been quite a couple of years for schools, obviously dealing with COVID, massively reduced numbers of staff and children, and we're mindful not to put too much burden on schools to have to be continuously adapting to an ever-changing landscape, especially at the moment. So that is something that we're trying to be sensitive to, both in terms of the length of the consultation when we've done it, and just the general level of promotion around it. We do want to hear from schools, because we do want to know how wide we can go with this in this year of our Lord 2022. There's a surprisingly small amount of time between right now and the 1st of January 2023 when it comes to actually doing the proper mahi to consider this. Obviously, a lot of it is it's clearances, it's departmental consultation, ministerial consultation. I know from my personal experience working in a comparable jurisdiction, I don't think it's possible to do before the NAGs cease to have effect. But I do definitely take Sue's point that a lot of this work has been done for New Zealand already. So that'll be something that I take a look at. But just to be absolutely clear, while we're really keen to get submissions of this kind, like recommending and promoting and advocating for food standards as part of this consultation, the current focus is still healthy drinks. So just wanting to kind of manage people's expectations around that a little bit.
So Dan, although this consultation is really focused on what you feel you can implement by the end of the year in terms of healthy drinks in schools, you really want to hear from us what we would like to see happening in schools, not just in the next 6 months, but in the long term. Is that correct?
I think there's a lot of evidence to support what you are suggesting be submitted. Don't be afraid to be aspirational either. Like, this is an entirely open consultation. Like, we really want to hear from experts such as yourselves and really everyone around the country, schools, teachers, parents, children especially. And just remember that none of this gets thrown away. Like, it can be a little bit frustrating. Obviously, New Zealand's a very small country. The ministries don't have the same wealth of data that I'm used to having back in Wales through the pupil level annual school census. So any and all information that you've got, please do send it in. But also don't forget to sort of number the people who are making the submission, because I wouldn't want to see this during the submissions analysis be viewed as one person's submission. There's a lot of people who are behind what you're suggesting to do today, and I think it's important that numerically that's captured.
I'd just like to ask our moderator before we finish if there are any questions from the chat that we can address.
What do schools currently teach about healthy eating? I know they have them for kindy, etc. But yeah, that's been mentioned a little bit, and I'm a bit unsure about that too. If anybody could just very briefly fill us in on what's in the curriculum at the moment.
So I don't know what they teach about. I mean, they just put in this thing about promote healthy food. There was no monitoring, nothing. So I suspect most schools don't do anything at all. Dan, is there anything in the curriculum required?
Max has a comment to make.
Even like all the way through up from primary school to now, I can only really remember 2 times that we really learned about eating healthy, and one was a program in year 6 where we had a nutritionist come into our class and talk about like how much sugar a Coke might have and show us in a plastic bag of how much sugar it really does, and like telling us what the amount of sugar is really good for you. And then also I remember another one where we all walked around Pack and Save picking out like a healthy balanced lunch.
So the answer is there is no requirement to promote healthy food at all.
I think it varies a lot from school to school. I'm aware of some schools that really do go in for it, but I think it relies a lot on individual interest and expertise.
Sarah Knowles from Taranaki here. Just a comment around the curriculum that I'm aware of, the Healthy Active Learning program, which is a joint program between Ministries of Health, Education and Sport NZ. And the Ministry of Education's component of that program was to provide new health and physical education and hauora curriculum resources. So I don't know detail of that, sorry, but it is something that is certainly underway.
Thank you all so much for participating in today's conversation. I think some really important points have been made. The first, I think, is that we have all agreed that healthy drinks should be extended through into secondary schools. That's a really important baseline that I think that we've come to. The second thing is that nutrition in schools needs to be addressed, and we want to look at providing healthy foods in schools primary and secondary. And the third thing is that all of this needs to be supported by education. The promotion of healthy food and drink and how we eat in our lives needs to be part of the curricula, and it needs to be provided by the Ministry of Education. Thank you all for joining us. I have a link below for you to go to the consultation and to make a submission, as well as some links in the comments section for you to find out more information about all the people who've been here today. From us, thanks. Goodbye.